how it's going to impact to ecosystems and affect public health. You just mentioned deforestation, mosquito, Zika is the problems. Now the factor, Aedes aegypti, is not only at the equator line, but it's moving north and moving south of the hemisphere. If the disease are not there, or the pathogens, that's good. But at least the mosquitoes are moving and trying to adapt with the unfriendly environment. And when the virus are also circulating, then that's going to be the problem. So those are the issues. Also the malaria, why it's malaria problems, because of the overpopulations. They want to have more human settlement. They open the forest, and that's going to happen. Okay. Those are the examples. Okay. These are the environmental changes and possible effect of infectious diseases. You can see the dams, canals, and irrigations. Examples of diseases: schistosomiasis, malaria, helminthiasis, etc. Deforestation, you will have malaria. Reforestation, you have Lyme disease. Those are the issue that, and also the pathways. You can see the pathways over there. It's very difficult, you know, if you have the background in health and you will take care of the impact, and some of the activities are not your field. How are you going to work effectively? So it means that you have to work with other professions, even beyond health professions. Sometimes it's very difficult because the mindset is different. So now it's your time to really think. How are you going to make your leadership in the future be effective? Let me ask you, and you can raise your hands. How many of those of you who would like to be a politicians in the near future? Politicians, one? No, I will not consider you because you're the MC, okay? Only one, okay. And the others, you don't want it? Because why? Why you don't want to be a politician? I'm sure most of you want to be a scientist, right? Because you are very exposed to the scientific activities in campus. And only one here want to be a politician. But if you want to stop the development of a dam, if you want to stop deforestation, you want to be a medical doctor and say, stop the deforestation, no one will listen. It's your choice. I'm just opening your mind. If you don't take it, someone else without health background will take the opportunities and control you. It's your choice. Globalizations. So let's talk about very big things. How this will affect health, or public health, or animal health, or ecosystem health, or planetary health. It depends on what we are doing in terms of industry, economic development will affect everything. And political movement from one country to the others, one group to the others, one small group to the others. If there is a radicalism of ISIS in the world, which is negative, it has negative impact, right? Why don't you discover a radicalization of a positive thing? I want to radicalize people to work together. I want to radicalize people to save the planet. Use the same similar approach, but for positive things. There are many people who think about negative things. I hope none of you think about negative objectives. All it has to be positive. because we need to have leaders like that. Okay? Oops. You see, it will affect everything. If you look at the transportations, it takes only less than 24 hours to go around the world now. You can stop by in some airports, countries, but you can go around the world in only 24 hours, within 24 hours. If you bring the disease, if the factor's there, the chance is there to transmit the disease. So that's why, and also the second is affects consumer preferences. For all of you, probably you don't like to eat dog meat, right? Or anyone would like to eat dog meat? You have to explore Solo. You find in the afternoon or during in the evening, there are small, street food vendors who sell sate jamu or rica-rica and others. But that's basically dog meat. In the city, in this culture, you see, that kind of preferences, and it happens not only in Indonesia or in Solo, also in North Sulawesi, and it's also in other places in Indonesia, also in Liberia, in Sierra Leone, and that's why we have Ebola. We, global, have Ebola. It's because of that, because of the preferences. So that's why the magnitude of the spreading, it depends on the movement of the people itself. If you move more quickly, more massively, so the transmissions of the disease will enable the disease to transmit to other countries when the situations allow. Okay. So emerging and re-emerging infectious diseases, this is the issue. 60% of the human pathogen are the animal origins. One of the example is what? It's the biggest problem in the world now, and we cannot control it. HIV/AIDS. Only with one problem, the world cannot stop this disease up to this point, decades. If we have Ebola, which is also from animal, and trying to domesticate it with the conditions, it will be a problem. Also Zika, even influenza, and there are more. So that's why we need to make sure that we prevent the risk factors of this disease to transmit. You see these global examples of emerging and re-emerging infectious disease. This is from Nature in 2004. There are many things over there. Anyone knows the current disease that are not there? Quickly, you can see there are new diseases that are not there. 2004, now 2017. Is Zika there? No. Ebola? Yes. Zika not. Are you expecting or can you prevent this mapping populated with new diseases? Can you? Very hard, right? Very hard. Because of deforestation, overpopulation, overfishing, etc. You can be one of the authors for the next publications on the newly emerged disease. Yeah? So this is an example. We need to have someone who will publish something like this, but we need to have much more or many more people who can prevent this picture to grow. Do you agree? Yeah, that is very hard. When I talked to former Minister Emil Salim, he pointed his finger to my chest. Wiku, everybody can see the rise of the lines in the figures, in the graphs, that everything is going up, populations, etc. Scarcity of resources is also increased, right? Everything is increased. And it's by 2050, there will be many people in the world. The question is, can we flip this trend into a negative one, slowing down? The scientists usually just drawing this line, which is going up, going up. If you cannot prevent that, of course, you can predict when by mapping the global, you will know in which area that will have a war because of that. So we need to have a new leader or new leaders who can flip this situation to make it balanced. So if I cannot do it, please do. You have futures, not only doomsday, but the future which is brighter than now. You have to work hard.